Hello everyone, I am Kalyani Shelar from Shivaji Rao S. Zondhali College of Pharmacy. I am studying in final year B Pharmacy. Today I am presenting review on sustained release tablet. Introduction. Sustained release dosage forms aim to minimize side effects and maintain steady drug levels by releasing medications at a controlled rate over a time. Their main goal is to improve bioavailability and therapeutic efficacy, often reducing the frequency of dosing. Common SR systems include osmotic, polymer matrix, and membrane control designs, with recent studies focusing on SR formulation for poorly water soluble drugs. SR tablets taken once or twice daily improve patient compliance compared to the standard forms that require multiple doses. The development of SR tablets is increasingly aided by optimization techniques like artificial neural networks and response surface methodology. Here the diagrammatic representation of sustained release tablet API containing core is surrounded by the water insoluble polymer which is contain release control channel. Release control channels helps to release the API in the body. Advantages: a reduction in both systemic and local reactions, improved drug use, and a decrease in the overall quantity of drug utilized, more consistent blood concentration, enhanced treatment effectiveness, and optimal therapy. A less fluctuating drug levels result in the more consistent pharmacological response, a quicker care or treatment of the ailment, and a smaller loss in drug activity with prolonged uses. Increase the bioavailability of some medications such as those that are vulnerable to enzymatic inactivations by encapsulating them in sustained release polymer systems. Increase adherence from patients. The significance of patient adherence for effective medication treatment is widely acknowledged. Disadvantages: dose dumping, less chance of doses modifications, it is more expensive than a traditional dose form, boost the possibility of first pass metabolism, proper treatment requires patient educations, the systemic availability may be reduced, poor relations between in vitro and in vivo. Ideal properties: it should be stable in gastrointestinal fluid and appropriately absorbed orally. Drugs that have short half-lives between the 2 to 4 hours make great candidates for SR dosage forms. A pharmacological dose of at least zero point 0.5 grams and no more than 1 grams is required to create a sustained release drug delivery system. The therapeutic range of the drug in sustained release drug delivery systems should be high and wide enough that changes in release do not result in concentration above the minimally hazardous thresholds. Objectives: reduce dosage frequency or improve drug efficacy by assuring consistent drug delivery, lowering the required doses, or localizing at the site of action, whether treatment continue for a few days or weeks in the event of an illness or for the whole of the patient's life, as in the case of diabetes or hypertension, a single dose would be given. It should carry the active component to the site of action, minimizing or eliminating adverse effects. High potency drug may cause serious side effects in vulnerable patients both locally and systematically. Classification: the control release system for oral use are mostly solids and based on the dissolution, diffusion, or a combination of both mechanisms in the control of release rate of drug. Depending upon the mechanism of drug release, three systems are classified as follows: continuous release systems, delayed transit, and control release system, delayed release system. Continuous release systems are further classified in five systems. Delayed release system further classified into two systems. Here the diagrammatic representation of diffusion control, dissolution control, and erosion control systems. Factors affecting sustained release tablet are physiological factors and biological factors. In physiological factors, dose capacity, solubility in water, partition coefficients, protein binding, etc. Biological factors, absorption, distribution, metabolism, drug half-life, safety margin, etc. Evolution, pre-compression parameters, bulk density, tap density, Car's index, harshness ratio, angle of reports. And post compression parameters, appearance, weight variations, hardness, friability, dimensions, assay, in vitro drug release, short term stability. Future scope and impact, sustained release dosage forms enhance therapeutic outcomes by extending drug availability and half-life, reducing dosing frequency and improving patient compliance. Pharmaceutical companies are increasingly adopting this approach, producing various APIs as a sustained release matrix tablet, anticipating broader use in the future. Conclusion, sustained release oral drug delivery has gained attention for its benefits in patient freedom, reducing dosing frequency, and improve compliance. Microparticles aid in enhancing bioavailability, stability, and dosage targeting. Overall, sustained release formulation improve patient compatibility and dosing efficacy with in vitro studies confirming effective sustained release profiles. Thank you.